Hi guys, so we're going to talk briefly today about the heart. We're going to look at some anatomy and some physiology, blood flow stuff relating to the heart today. So, a few things to remember first and foremost. We've got the left and the right side of the heart, and that is always represented as if it's in a person looking towards you. So as you can see in this diagram here, this says left atrium and left ventricle, even though as you look towards the screen, that's on your right side, okay? It's as if the person is in the screen looking back at you, that would be their left. So just always remember that, that's really important. Also need to remember, blood always flows into the heart via the atrium, then it will travel down to a ventricle, and then it will travel out of the heart. That happens on both the left and the right side of the heart. Now, you'll notice that there is a difference between the left ventricle heart wall size, thickness, and the right ventricle heart wall. Okay, now that's for a very important reason. That's because the left ventricle is responsible for pumping oxygenated blood, so blood full of oxygen, to the entire body, to the systemic system, okay, the systemic circulation. So for that chamber there to pump blood to the entire body, we need to remember that it's travelling a long way, and it also needs to have a pump force strong enough to go against gravity, because it's got to pump blood hard enough to travel down, for example, to the feet and all the way back up to the heart against gravity when you're standing. Okay, it's not like we have a heart in our toe helping to pump blood back up to the heart. We don't. So that one pump from your heart needs to have enough force to get it down to the feet and back up to the heart. That's why, just like if we train, we make bigger muscles if you do certain types of training. Okay, same happens with that heart. So that heart wall there for the left ventricle is thicker than the right ventricle, because it pumps oxygenated blood to the entire body. The right ventricle does not, okay, and we'll talk about that in a tick, but briefly, it only has to pump blood to the lungs and back. And if you think about where the lungs are situated in your body in relation to your heart, they're very close, okay? There's not much of a distance that blood has to travel, so it doesn't need as much force there. So, another thing to remember, arteries always take blood away from the heart, and veins always bring blood to the heart. So for that reason, when you're looking at this diagram here, we know that these vessels here, they lead into that left atrium. Because they're bringing blood in, it must be a vein. Okay, same with here, these also lead to here. Okay, so that's the left atrium here, and it's the pulmonary vein that's bringing the blood in. Now, anytime you hear the word pulmonary, you need to think of the lungs. Okay, pulmonary is to do with the lungs. So the pulmonary vein is bringing blood to the heart. It's a vein, it's bringing blood to the heart, and it's bringing it from the lungs. So if the blood has just visited the lungs and it's coming to the heart, this blood is going to be oxygenated, so it's going to be full of oxygen. Okay, blood comes in here, it gains enough pressure, okay, to open the mitral valve. It comes through the mitral valve into the left ventricle, where it builds up enough pressure then to open the aortic valve. Okay, remember, it's all got oxygen. So this blood with oxygen then gets pumped out via the aorta. It's a very, very big blood vessel. It's an artery. It's taking blood away from the heart. Okay, it takes it away from the heart to the body, to the systemic circulation, to deliver oxygen. Okay, once it's been out through the body, it comes back to the heart via the superior and inferior vena cava. Okay, because blood's got to come from your head and it's got to come from your lower extremities. So it comes back from the body via the superior and inferior vena cava. Now, because it's coming back to the heart, these are veins. Okay, comes into the right atrium because the blood has been around the body delivering oxygen. When it gets back to the heart, it doesn't have much, so we call that deoxygenated blood. It doesn't have much oxygen. So that deoxygenated blood now needs something before it goes to the body again. It needs oxygen, okay? So it comes into the right atrium, builds up enough pressure, overcomes or opens the tricuspid valve, builds up enough pressure in the right ventricle, then it opens the pulmonary valve and heads out via the pulmonary artery. Remember, artery takes blood away from the body. Pulmonary means lungs, so it's taking the blood away from the heart. Takes the blood away from the heart to the lungs to collect oxygen. And then the cycle starts again. Once it's been to the lungs to collect oxygen, it comes back to the heart via the pulmonary vein. It's got oxygen. So off we go again. Oxygenated blood into the left atrium, through the mitral valve, into the left ventricle, through the aortic valve. That blood with oxygen travels to the systemic circulation via the aorta, okay, which is an artery, takes it away from the heart. Goes, delivers oxygen to the body, comes back without oxygen, or with not much oxygen, via the superior and inferior vena cava, into the right atrium, via the tricuspid valve, into the right ventricle, through the pulmonary valve, out, away from the heart, in the pulmonary arteries, to be delivered to the lungs to collect more oxygen. And so the cycle goes. Make sure that you've taken notes in this video, stop, rewind it as many times as you can. But that is the anatomy and the flow of blood through the heart in a nutshell. Enjoy.